Welcome, my name is Brent Murphy. I'm the president of Radiological Technologies University. I quickly want to talk to you about RTU's program in medical imaging for computed tomography. RTU is a nationally accredited university. We offer bachelor's and master's level degrees. The medical imaging degree is an associate's to bachelor's program. We want to focus on CT. We offer 4 in that discipline. We offer specialization in CT, MRI, nuclear medicine/PET, and ultrasound. Today we'll just focus on the CT. RTU program highlights, as a nationally accredited university, we spend a majority of our time focusing our degrees and curriculum on the radiological sciences and those courses and curriculum that support the radiological sciences. So on the medical imaging side of the house, it's an AS to BS program that can be completed in 16 months. We utilize a hybrid or blended learning environment that capitalizes and optimizes on the use of virtual online training in addition to the hands-on and on-site boot camp training. Okay, you can finish this in 16 months. We have very aggressive clinical faculty, so we're in the trenches, we're up to date on the modern and current technologies, and financial aid options are available. So what make our programs different from other radiological science-based programs? First, we have a very clinical faculty. We're in the trenches, they have a great diversity, they stay on top of what's current and where the future is going. That allows us to share that with the student. The networking, we establish a community, okay? We're a family. Our graduates are still engaged with our students. Our faculty are engaged with our graduates. Our faculty are engaged with our students. The modern day curricula, okay, and dynamic curricula allows us to focus on the new hot topic items, the new technologies, the informatics, and the benchmarking and metrics that are required now in our field to advance these technologies. It's a good thing. We need to accept it. Very few people truly understand it. Radiation safety doesn't go away. With these new technologies, safety is actually is at a higher level. We need to really stay on top of this. So for example, on CT, even though we teach the didactic, we tie it into practice, and we'll put a strong emphasis on some of the current technologies or current hot topics within the technologies. For example, CT dose reduction techniques. That's going to be around for a while. We do a lot of CT. As a population, we need to keep those exposures and doses low. Low dose CT screening is another example. Use of contrast media. For years now, we're starting to really capitalize on using fine CT slices to reconstruct 3D visualization and use that to help in surgery. Fantastic technologies. 4D imaging, being able to track motion at the same time that we're getting anatomical information. Very powerful. Still untouched as far as what we can do in the future. And then perfusion studies as well. So we stay on top of that. You learn that didactic, we stay on top of the current and hot future topics, and we pass that on to the students. And as a graduate, part of the team, part of the family, you're privy to be included in all that information sharing. That's what makes us different. RTU core values, that pretty much sums up what we're about. Clinical compassion, we need compassionate students, graduates, faculty. We will teach you, okay? We will share, students share that are in the field. This is what creates competency, is people understand what they're doing instead of just being button pushers. With the competency becomes confidence. They can become confident in themselves, confident in the technology, confident in advancing the technology, confident in expressing their desires, their concerns, their questions to physicians. Keep that dialogue open. Compassion, competency, and confidence, and then having the ability to communicate with peers, colleagues, students, residents, interns, physicians, administrators. In each one of those, it's a slightly different technique of how you communicate your knowledge or the questions that you have. To learn more about the RTU programs in medical imaging, please visit our website at www.rtuvt.edu. Thank you.